along with my producer, Stephanie. And we have the pleasure today of having Dr. Tony Dale, founder of Sedera Health, on our podcast today. He is going to be talking about his book that he wrote called The Cure for Healthcare. And I had the pleasure of meeting Dr. Dale at the Free Market Medical Association back in August, and I am super excited to be interviewing him today. Today we are having issues streaming live to Facebook, but we are streaming live on YouTube also. And as always, you can catch us later when we have the edited version. And stay tuned, because when Facebook is back up, we will definitely have the show back up. So thanks for tuning in today. And Dr. Dale, I am going to let you take over and talk about the history of your book and what your book talks about.
Well, thank you so much. It's a real privilege and pleasure to be on this podcast with you. I've been very much looking forward to this time. I'm very, very happy to share a little about the book, and then, of course, feel very free to ask questions and take our conversation whatever way you think is most beneficial to your audience. But I guess the reasons for the book are that throughout my life, I've seen the power of the written word. There's a very famous saying, probably a Shakespearean comment or whatever, that the pen, the pen is mightier than the sword. And I'm very aware that, at an opportunity like this, it's a wonderful privilege to share something. But the thoughts and ideas, of course, nowadays are all captured by video or whatever. But the written word is still extremely powerful. And so as I began to experience more of what healthcare was about, I guess the ideas for the book have been bubbling around inside for a number of years. But what actually prompted me to decide, no, I've just got to create the time and space to do this, was when I read Professor Marty McCary's book, The Price We Pay. Now, he does a brilliant job of peeling the layers off the onion. And this is an onion that is going rotten. That there's that sense as you read through his book, oh my goodness, I knew things were bad, but I hadn't realized they were this bad. And of course, for myself, being very, very involved in this world for 25 years at this point, having started a company that has negotiated hundreds of millions or billions of dollars of medical bills on behalf of consumers, then starting Sedera and, really helping create a alternative model so that we don't live with this misconception that somehow insurance is the only way to deal with large bills. It's one way. It's a good way in some circumstances, but it's certainly not the only way. And so, with all of this sort of ideas bubbling around inside, what I said to myself, wow, Professor McCary, you've done a brilliant job outlining the problem, but we've been hearing about the problem for years. We've got to find what the answers are. And I've been very privileged within Sedera getting to meet all sorts of wonderful people. And of course, the book is really a book of stories. Yes, many of the stories are personal. They're my own experience. But also, I tell the stories of particularly of a variety of other physicians and what they're doing. Because I think answers for healthcare are already emerging under our noses. It isn't just that we have, as it were, an insurmountable problem. No, we don't. The power of the free market is actually already showing people the way forward, and that's what the book is about.
So, what you talk about the fix, and I agree with you. Marty's book, The Price We Pay, doesn't really talk about a fix. So, tell us about how your book differs and it has a fix. I'm assuming that it has to do with the non-insurance model, or?
Well, no, it goes much, much broader than that. And so if anyone is thinking that this is a book about me and about Sedera, that would be completely missing the point. That's a small part of it. But what is emerging is really a whole free market medical ecosystem where the genius of many different people is coming to the fore, where I describe what's happening in direct primary care membership practices, as
Mhm.
most of your listeners will know, or what people like Dr. Keith Smith are doing, through his pioneering work at the Surgery Center of Oklahoma, or the remarkable growth of green imaging that Dr. Kristen Dickerson over in Houston, has pioneered a model sort of based around the concepts of Priceline, just using surplus capacity. And what happens is that when thoughtful people become concerned about what they see going on around them, their minds naturally engage into the whole question of how can this be done better? And the answer is that there are all sorts of ways that things can be done better. And oh, by the way, this not only gives people a dramatically sort of improved experience of healthcare with higher quality care, but it also, in the process, just significantly reduces the cost. We're not talking by 1 or 2% here or there, or maybe 5% over there. We're talking people seeing 20 and 40 and 60% reductions in their overall costs of having access for themselves, or in the case of companies, for their employees, through these innovations that are occurring.
Yeah, Dr. Smith says that it's usually 8 to 10-fold savings versus traditional health insurance model payments when it comes to using the free market system, which is just astonishing. I mean, it's almost hard to believe.
Well, he's a wonderful storyteller and masterful with words. And he's absolutely right. In almost every other area of economics, we think in terms of, higher price usually implies higher quality. In healthcare, that is absolutely not the case.
Yep.
In fact, most of us intimately involved in the system feel that it's more likely to be the other way around as you
Yeah.
start digging in.
Yeah, I agree with you, and that is something hard to believe. And I will tell you, some of the big corporate healthcare systems that are, largely entangled with big insurance models, they want to argue that a cheaper price is less quality, and when in reality, I think it's greater quality because somebody like Dr. Smith at the Surgery Center of Oklahoma, they work on a small margin, and so they have to be efficient and have the best surgeons, the best doctors, so they can't afford to lose money.
Yeah, and Shawn, it goes beyond that. The reality is that when you then start looking even at the clinical care, the patient experience, the rate of infection,
Absolutely.
when you allow the power of the free market to come to bear, it naturally leads towards a continuous improvement process. So yes, I think it's incredibly important for people to understand. And it's one of the reasons why, as I like to talk about what's emerging, the key issue isn't the savings. That's a fantastic byproduct. But, as a family doctor myself, although I've not practiced over here in the United States since I moved over here, I, trained at a world famous institution in London. I love to mention this. It was established in 1123.
Wow.
That sort of puts American history into
Right.
context.
I mean, when we think about that in America, it's astronomical. We can't even, can't even think about that. It's hard to think about.
And I love to tell people they've actually seen my hospital, almost everybody, although they don't know it, because it shows up in Braveheart. Because right at the end of Braveheart, where he's hung, drawn, and quartered, now of course, whether it's literally filmed at the hospital, I doubt, but there's a plaque on the hospital wall saying, right here in this place is where William Wallace was killed. And
Wow.
so the hospital had already been there for a couple of hundred years before William Wallace. So, but that's neither here nor there. All I'm saying is, I, like so many physicians, yes, I have a strongly academic background, but the passion that pulled most of us into medicine is that we love to help people. I come from a family of family doctors. I grew up as a sort of an 8, 9, 10-year-old, going with my dad on home visits in the middle of the night and seeing how people received him and seeing, how he took care of them. And it didn't matter to him if he was dealing with the poorest of the poor or if he was dealing with an ambassador from some country. And he regularly dealt with both in the context that we lived in. But what I saw was this incredible heart for helping to make people whole. And so when you then find yourself in a system, and in my case, when I then immigrated over here, working with physicians rather than directly with patients, and began to hear the stories and begin to meet friends and all of this sort of thing who could tell me some of their horror stories. This naturally made me want to dig in. And of course, I touch on this a little bit in the book where I describe my own first direct experience of the American medical system. Now, the medical care I got was fantastic, but the shocker came in the sticker price. And when you begin to dig into that and take off the layers of this onion, I realized immediately, being a physician myself, that someone was ripping off the system. I just didn't know who or what it was. And so I took the opportunity at that point to really dig in. And what has grown out of that is the business solutions that I've brought.
So tell us about some of those business solutions. I'm familiar with Sedera Health, but you talked about a group earlier on that you've done for 25 years to save patients money. Is that correct?
That is correct. I started the CARIS group as it was known then. It's now actually been taken over by my son, who's far brighter than I am. So it's in good hands. And it's now called Point Health. And Point Health exists to show people how they can navigate the healthcare system in a way that brings them access to quality care and in the process gives them fair access to reasonable pricing. So yes, we started this. I actually started it on behalf of some of the Christian healthcare sharing ministries. I think our first client was Christian Care MediShare. And very quickly, based on my own experience of the system, I really sort of figured out what we needed to do to help them. And so I began to help them and train their staff and this type of thing. And, over those years, as they were growing very rapidly, helped them save millions and millions of dollars for the community. And so this interest has grown out of that initial experience, which was of my own experience. I, without knowing anything about the system, knocked down thousands and thousands of dollars of bills on a very simple medical procedure, which I'd been told would cost $2,000. But because I didn't understand the system, I didn't realize that the doctor was only talking about his charge. Actually, I got $15,000 of medical bills in 1996. So in today's terms, about $30,000 worth of bills for something that even today, $2,000 would be ample. And I suspect if I looked up the Medicare price on that or the Medicaid price on that, it might be $2,000 or less.
Right, right. And so after that situation is when you started.
That's when I started what was then called the CARIS group, but now Point Health. That is correct. And it was out of my experience over the next, I guess, 15 years. When I got to 2010, when the Affordable Care Act was passed, I think, for myself, having been so engaged in the system and, having, like I say, being involved in negotiating, hundreds of millions of dollars of bills, I knew that we couldn't just put some sort of a Band-Aid on a serious societal problem. And right from the start, I said to people, the name of this act in those days it was called the PP ACA, I think it was Patient Protection and Affordable Care Act. It's interesting that they've removed the PP now. It's not protecting the patient. In fact, the patient's costs have doubled. And over the last 10 or 11 years of the Affordable Care Act, we've moved from a nation where, the problem, if I can put it that way, prior to the ACA, was that we had a significant number of uninsured people. The pundits talked in terms of 20, 30, 40 million. Whether those numbers are accurate is probably, a technicality that I'm not sure it's worth getting in deeply, but many of us think those numbers were inflated. But instead now we have a nation of people where the vast majority are functionally uninsured.
Right.
And what I mean by that is by when you move everybody into a high deductible environment, the normal now for an individual is $5,000. By the time you add spouse and children, it might be $10, $12, $15,000 of deductible. But the average American does not have $5,000 of disposable money to be paying on their deductibles or their copays. And so they've been left for 19 out of 20 people who won't have a major medical incident in any given year. They've been left where they're paying for something that actually leaves them still likely to be found in bankruptcy if they have to go through a major medical event. And we need to find ways to change that. And of course, the medical cost sharing model that we're doing, along with all the other elements of the free market ecosystem that have emerged, are showing excellent ways of dealing with that problem.
Yeah, we've discussed that on this podcast many times about the health sharing models, and I'll have you go into Sedera a little bit later. One of the things is that I wrote a book about some of the things you're talking about, and it's called Sickened: How the Government Ruined Healthcare and How to Fix It. And one of the issues is one of the fixes is health sharing models, because I don't think the traditional health insurance model, it's a big monster that's really, really hard to tame, and I think we just need to circumvent the system and use health sharing models instead of typical insurance. And I think driving patients that way and letting them drive their own health care and be proactive in their own health will set the free market in motion, and that's really what's going to fix the system.
I completely agree with you. And the power here is that in a free market, you have a supply side and you have a demand side. Now, if you went back even as little as 10 years ago, even the demand side for the free market was nothing like as strong as it is now. But I think the impact of the ACA, almost the opposite probably of what was planned, is that it's shown us how bad the system has become. And into that context, we're all crying out for solutions. And in that sense, I don't think one's looking at a political thing here. Patients are patients. It doesn't matter whether
Right.
their political views are from the left or from the right or somewhere in the middle. What they're saying is, please show me a way that I can get the care I need at a price I can afford. And when we recognize that, our country here in the States, because I'm an American now, having, immigrated here in '87, our country is spending twice as much as any other highly industrialized Western type nation to deal with healthcare, but it's not delivering twice the quality to everybody for that price tag. And so as we begin to look at that, I think inevitably anybody who really cares about that says, well, if the average family is now spending over $20,000 for their health care. Now, lots of families don't realize that because maybe a big chunk is paid either by their employer or by the government on their behalf. But when you average out that $4 trillion price tag that we have with 350 million people, that's the sort of price that people are spending, sort of $20,000 to $25,000 a year for the typical family. That's money they're not seeing in their wage packet. And part of my argument in the book, The Cure for Healthcare, is that when we look at the last 30 years, okay, the typical increase in salary that really has been a part of, can I call it the American dream? But, just the reality that every generation's children have come to expect that they're going to do better than their parents. That is not true anymore. Either in practical reality, in terms of spendable dollars in people's hands, or in terms of the national psyche, where now, there are a huge number of people, including, I think, really sadly, a lot of the young people who are thinking, maybe life's going to be worse for me than my parents, and maybe there's something wrong with this system. Maybe free enterprise, as it's practiced in America, isn't the answer. And so, it's leading people to ask questions that need to be asked, but they're missing the fact that we don't have a free enterprise system in healthcare. What we have a system which is, I guess, drastically altered by the impact of the middleman, whether the middleman is the government or is the insurance company or is, the regulatory bodies or whatever. There's so many layers between doctor and patient. I mean, one of the graphs that people would find very early in the book was one I came across about the growth of the administrative layers within the healthcare world compared to the growth of the number of doctors. And I don't recall the exact dates, but it showed a sort of 10 to 15 year period, approximately, let's call it 1995 to 2010. And the growth in the number of administrators over that time went up approximately 2,000%, while the growth in the number of doctors went up 150%. Well, that tells you where a lot of this money is going, and it's not bringing us a better result.
No, not at all. And, I think one of the things is that people think that we need to look to the federal government for answers to fixing the healthcare. So if people believe that our healthcare system is broken, the problem is that 70% of all healthcare is paid by some government program, whether it be Medicare, Medicaid, VA, and then most of the rest of it is actually, traditional health. We call it private insurance. But the reality of it is, in my opinion, there's no such thing as private insurance, because if it's traditional insurance, it is so heavily regulated by the federal government. They are told what to pay and how much to pay and on what they can pay. So it's really all government insurance anymore. And that's why a free market solution like a health sharing program is really the way to go.
Shawn, I think a thing that many people don't understand in this context is that when we take the consumer out of the process, Americans are geniuses, especially when it comes to shopping. And if we can shop for a complex, Boeing 747, if we're running, a company, or if we can shop for a new car, if it's for me as a consumer, it doesn't matter whether it's simple or complex. People know that they can shop for something of value. And if they don't feel they're getting value, they can go somewhere else. In healthcare, that's not true. Now, I think the reason for that is not the left or the right. I think it's the left and the right.
Oh, yeah.
Meaning that, as you put it, government has inserted itself in this process in such a way that whether it's the crony capitalism you have from the right or the sort of push towards government power and control that you have from the left, neither of those is likely to lead to the sort of liberating innovation that I describe in the book of the extraordinary things that are happening. I mean, as a family doctor, I love what I see happening in the direct primary care movement, where, doctors have got their life back, and they've got it by doing what they trained for, which is loving on their patients and choosing to perhaps only look after 500 patients at a price that is less than the price of a cup of Starbucks coffee each morning. Way less.
Way less, right?
And they can do it for that price and give an incredible service to people. Okay, all of this type of innovation, I mean, go from something as practical and down to earth as that, as say LASIK surgery, and just look at the drop in the price of, this amazing technological eye surgery that has gone on. The market is able to deliver this if we take the chains off the market and allow people to show their innate, what I would understand as a God-given sort of creativity to constantly improve.
Absolutely. So tell us a little bit about innovative solutions, and Sedera is one of those. Tell us a little bit of the history of Sedera and what Sedera is.
Okay, well, I think to describe that history, I would have to start and give credit where credit is due. And that is that the basic concepts of what we now call medical cost sharing grew up among the Christian healthcare sharing ministries. And going back, actually, I think it was to 1981, the first of these groups, the Christian Brotherhood, and then subsequently in the early 90s, groups like Samaritan Ministries or MediShare began. These groups said, at its simplest, that the Bible teaches an approach to life where it was said of the early Christians that there were no needs among them because whenever any had needs, they shared. And so they literally grabbed that language and they said, why don't we do, for example, what the Amish from a religious background have done? Instead of, the Amish, instead of insuring buildings, and if a fire came and the church building got burned down, what do? Well, they didn't ask an insurance company to bail them out. They said, hey, community, let's come together and let's rebuild it. And they just rebuilt it out of their pockets. Now, that's a relatively simple and very, very rare circumstance to have, a building burned down. It's actually a circumstance where insurance works remarkably well. Mm-hmm. But when you move to a very common situation, the question is, could that sharing model work? And what these Christian groups demonstrated was, yes, you can take that innate desire for community, the trust that we can have between each other, and you can build that on a sort of financial and technological model in such a way that you can give people an effective way to deal with the large medical bills that people might experience from time to time. Now, having worked with those ministries to help them understand more about how to negotiate their bills and have fair pricing and all of this, obviously I had observed over many years, over pretty much a 15-year period leading up to the Affordable Care Act, what they were doing. But I'd also been doing similar work for many of the insurance companies, because in those days, there were limited medical benefit products and, products that were just for short term and all sorts of things that, sadly were sort of outlawed by the Affordable Care Act. Right. And so, as the government tried to mandate and narrow down to what could only be handled by a few mega corporations that, of course, were delighted to get whatever extra business the government was going to give them, especially based upon the concept of a medical loss ratio where their profits were limited to a certain percentage. So what do? Let's just keep putting up the premium cost. And then what we're earning year by year grows automatically. That there are such simple principles involved here. But, seeing these things, I actually tried over a pretty extensive period of time, a couple of years, meeting with some of the leaders within the Christian healthcare sharing ministries and encourage them to, let's open this up to anybody and everybody. But by then they were protected by the Affordable Care Act. And, the trouble with government protection is it looks so nice. But if the government can give you that protection, they can take it away. Yep. And, as I looked at this, I just said, but surely as Christians, isn't your call to the world? Don't you have a responsibility? If you've got something good, aren't you going to give it away? But I guess I'm kind of naive and idealistic. And, when they already had something very valuable to lose if it didn't work, and with an exemption that was based on the fact that they would only work with active evangelical Christians who could sign their faith statements, I guess what I was saying sounded crazy. But I just felt, no, we have an obligation to this great country that has given all of us so much. If we've got a good idea and the country is going bankrupt because of healthcare, then we have every obligation to share it with the nation. And so I began thinking and researching, how can we take these fantastic concepts, as simple as they are, and even within the complex regulatory environment that we live in, surely there's a way that we can bring these and extend them to anyone who wants to use this approach rather than just to evangelical Christians. And so that was the foundation in the thinking of Sedera. Now, it took almost 3 years from 2011 through 2014 to do the R&D, particularly in the sort of legal and regulatory environment, and to try and figure out what could be done. But Sedera was started into that environment. And obviously, as a high-tech solution in the middle, sort of somewhere in between banking and insurance in most people's minds, and borrowing from the sharing economy, learning from Uber and Airbnb and others in terms of what they're doing. Yes, this is a very complex and highly regulated environment, but it's also a very wonderful environment because it's an environment that is absolutely ripe for disruption.
Yeah.
Everybody has a pain story tied up with the healthcare system. Everybody knows someone personally who's been hurt, not often medically, although sometimes that's the case, but everybody knows someone who's been hurt financially. One of the stories I love to tell, it's there in the book, of Professor, Firuz Danishgari, just absolutely a world-class surgeon, founder of a whole new sub-department of in between gynecology and urology that he founded at the Cleveland Clinic, and just a remarkable person. I describe in the book how he did a vasectomy for someone. I think it was a friend, because typically a professor wouldn't involve himself in something so simple and straightforward. Something that could cost maybe a couple of $100 if it was done, as an outpatient thing in the gynecologist, or, probably not the gynecologist for a vasectomy, but done in the surgeon's office, a urologist.
Yeah.
In that context, maybe a fair price for the surgeon's price would be $300 or something. Groups like Planned Parenthood, which I'm not a lover of because I'm strongly pro-life. As a doctor, I committed, it's part of the Hippocratic Oath, that first I would do no harm. What a tragedy to me that we would even consider harming the most innocent among us. But that's its own separate story. If a person did go to Planned Parenthood, they could probably get a vasectomy for $300. Okay, his friend came back to him and showed him the bill. $9,000
For a vasectomy.
for a vasectomy.
Wow.
And that's when Professor Danishgari said, I can't do it this way anymore. If that's what a hospital system is able to gouge out of a patient and their insurance companies or whatever for what I'm doing, I need to find a better solution. And there are doctors all over the country who are making the same decision. Keith Smith is the first one who said to me, I began to recognize myself as a financial serial killer.
Yeah.
That's pretty tough language.
One of the things he told me, and I put it as a quote in my book, is he said he literally felt like an accessory to the crime. And I used to hate calling my colleagues out or other doctors out that are in the field that are doing stuff like that, because I do feel for them. But until they get out of the system, they are essentially an accessory to the crime.
What you're saying is so important, because it's not just doctors, it's insurance brokers, it's insurance executives, it's hospital senior management.
Yep.
Somewhere we have to say, I'm party to what's going on. I can't pretend ignorance.
Yeah, that's absolutely true. So that's a great story, and it just tells you what the system has done to rip off patients. But it doesn't have to be that way. There are free market solutions. Read Dr. Dale's book. There are solutions to it. And you don't have to put up with it. And then one of the things that our goal is, if this podcast, is to educate and empower consumers to take charge of their own health. And that includes financial, because that's very, very important.
It's incredibly important.
Yeah. So, Dr. Dale, I appreciate you educating us today, and definitely you've met our goal of educating and empowering individuals. I'm excited to read more into your book, and I do want to hear a story, though. At the Free Market Medical Association, you discussed a very, very special story that I think made everybody in the room, it made their hairs stand up on their arms. So can you tell us that story? Very personal.
It is very personal, because it's been a significant part of shaping my medical career and the things that I've done around the medical world. You're referring to a story I told, I think it was the winter of 1975-76. And in Britain, it was a winter of discontent. The family doctors and all doctors, I was still in a residency program. For the first time ever, doctors working in hospital had gone on strike. And so at a go slow, where technically we had said as doctors we would only work 40 hours a week because we were typically working in our residency programs more like 100 to 120 hours a week. Actually, because of what was going on in the nation, which now included a flu epidemic, very reminiscent of where we are with COVID at the moment, all of us were still working 100 to 120 hours a week. And flu is a serious killer. And so people were dying like flies all over. And on this particular night, the group of physicians I was working with that I was training under, we were responsible for the hospital intake for that night. And Mr. Smith was admitted under our care and was on my ward where I was the primary physician responsible for him. And, you know, he had the flu and he had pneumonia and he was getting better quite quickly. And so he had only been with us 4 or 5 days. I came essentially with a view of doing a discharge medical on him, checking everything was okay. And when I was listening to his chest, I couldn't hear things really well. And I said, you know, do you mind, Mr. Smith, just slipping out from the bed and standing up so that I can have a proper listen to your chest? And as he stood up, he had a cardiac arrest. And so immediately we called the crash team. We were able to resuscitate him. And for the next couple of weeks, he was hanging between life and death in the intensive care unit. And then he began to slowly recover. And so during this now protracted period of time, I got to know him pretty well. And he was a fascinating guy. I'm so glad that I've always loved my patients enough to, ask them meaningful questions and to be willing to expose myself as well in that sense. And I found out that he had a number of kids. Now, this was important, though, because when I asked him about what they did, one of them actually was chairman of our area health authority. So meaning about 20 administrative levels beyond me as the junior doctor there. He had a son who was my boss. I'm glad I found that out. Now, I also found out about him. He was a fascinating guy. I lived and worked in the East End of London, which, if any of your viewers have seen things like Call the Midwife or EastEnders, they'll know it's a poverty-stricken part of London. And he was a cobbler. He made shoes and he made handbags. And that's actually a very important point for this story, because it came to this now last day when he was ready genuinely to go home. I got called on my pager. We used pagers in those days. And when I called, they said, Mr. Smith is ready to go home, but he'd like to see you before he goes. And so I said, of course, I would be delighted to see him. And I came down to the ward. And he pulled out of his bedside locker a package. And he said to me, "Oh, Dr. Dale, I've got a gift for you." And then he said, "Oh, well, actually, it's not for you. It's for your wife. I know I'm not allowed to give you anything." And I thought to myself, not being necessarily totally altruistic, "Oh, why aren't I allowed to get anything?" But be that as it may, of course, I very quickly pushed that away, and I said, "Oh, well, thank you so much." And he said, "Oh, it's kind of special." He said, "It's a handbag," but he said it's identical to the handbag that I made for the Queen.
Wow.
Now, when you're English, that's like amazing. And my wife still has that handbag. She hardly ever brings it out, but on super special occasions, it comes out. But, what changed my life was what came next. As I walked away from his bed, and, maybe not all your listeners will sort of understand exactly what I'm saying here, but there's that sort of still small voice inside. Many people would call it conscience. For me as an active Christian, I would call it the voice of the Holy Spirit speaking to me. As I walked away from that bed, it was like this still small voice inside. And this is the weird thing. It sounded really sarcastic to me. And it was like God was saying to me, "Well, Tony, everybody thinks you're fantastic. Mr. Smith just told you how fantastic he thinks you are. The nurses and the staff here, they think you're fantastic, but none of them know why. And he reminded me of something that I'd been reading. I, take Bible reading seriously. I feel there's so much to learn from such an amazing book. And I've been thinking about a verse that comes in one of the Old Testament prophets where it says this. It says, "I am the Lord, that is my name. My glory I will share with no other." And I found myself thinking as I walked away from that bed, if I was going to live an honest and integrated life with my patients, with my colleagues, with my family, then there's no way I could take glory for what God was doing inside my life. And I had to learn how to open up, even like in a time like this interview, to say the reality of what we can experience, and if you like, the joy and the peace and the competence that others might see in my life is a direct consequence of the way God has worked in my life, for which I'm just so profoundly grateful.
Well, I think that comes out as obvious when people talk to you, and I know it does when I talk to you. So thank you so much for that story, and thank you for being on our show today.
Well, thank you so much for the opportunity. It's been a privilege to be with you.
So, Dr. Dale, as we wrap up, how do we get a hold of your book? How do people get a hold of your book?
Okay, well, they can get hold of the book at Amazon or Audible. All of the classic places they can go and for it, and it's easily accessible. If you prefer listening, go for a listening version. If you prefer the written version, go for the written version. Yep, just look for The Cure for Healthcare by Dr. Tony Dale. And if they're wanting to understand what we're doing at Sedera, they just go to sedera.com. That's sedera.com. And we'd love to be able to help them or the company that they work with.
Sounds good. I really appreciate you being on. You've definitely inspired me and made me realize why we go into healthcare. It's to help people. And thank you for being on today. I really appreciate it.
It's a pleasure.
And Monday, tune in because we will have somebody from, I don't know the name of the individual, but they will have somebody from Sedera Healthcare talk specifically about Sedera. So tune in Monday, 12:30 to 1:30 Pacific Standard Time. And this Wednesday, where our midweek podcast is changing from Thursday to Wednesday because of my travel schedule, we will have Casey Young on. She is a nutritionist and a personal trainer, and she is going to talk about how women should stay healthy past 40. So you don't want to miss out on that. 8 to 9 a.m. Pacific Standard Time this Wednesday. Tune in to Health Solutions with Shawn and Janet Needham. And thank you for listening. Thank you for tuning in today. Health Solutions with Shawn and Janet Needham. Thank you.